Hello, good people. How are you today? I hope that you are doing well, and I hope that today finds you in perfect peace in every area of your life. So, today is June 27th, so that makes it the 27th day of Uterine Cancer Awareness Month. And as a uterine health advocate, I am committed to sharing something every day regarding uterine health, uterine cancer during this entire month of June, the Awareness Month. I also would like to say thank you. Thank you for your engagement with the channel. Thank you for your viewership. Thank you for your subscribing. Thank you for liking, commenting, and all the things that brings engagement towards this channel. I really appreciate it, and I appreciate you as well. So I always like to make my disclaimer that it's always in the description, but I want to make sure I make it verbally. I am not a medical doctor. I'm a uterine health advocate. Okay, so today I want to talk about hysterectomy. It's a subject that needs to be, talked about because I have not addressed it so far during this month or even on this channel. And it's a huge, it's a huge subject because it does affect our uterine health in so many different types of ways, right? So during this month, I've shared various topics depending on your medical condition or your medical diagnosis. A hysterectomy could be advised to you as your only option, your first option, or it might be presented to you as the last resort to help eliminate whatever the diagnosis and condition you might be facing in your own body that we as women suffer through. So it is important for me to bring light to this subject and talk about it and figure out what it is and go from there. Okay. So a hysterectomy. So per usual, I just went online and just did an internet search, and I put in the search, what is a hysterectomy? And this is what was the information that was brought to me. And then of course I go down a little rabbit hole and do some kind of research as well, additional research, I should say, fact finding information. And again, on this channel, I try to bring you just like the top level bullet point information. I provide you articles of reference at the end. This is just information for you to know. And if you're curious even further, then you can start your own research for it. But this is just to bring encouragement. This is to bring take the stigma away. This is me having a conversation with you about it. It's me hoping that that you have, when you get more information, you'll have a better and informed conversation with your medical care provider, and hopefully that leads to the right course of healing for you and your body. Hysterectomy. A hysterectomy is a surgical procedure to remove the uterus, the womb, and depending on the medical reason for the surgery, the procedure could also involve removing your cervix, your fallopian tubes, and the ovaries. I chuckle at that because sometimes I want to say fallopian tubes, but it's fallopian tubes. So a hysterectomy is a surgical procedure that removes your entire uterus, which is your womb. And depending on your medical conditions, you could also have your cervix removed, your fallopian tubes removed, and your ovaries. So two key facts about hysterectomies: loss of fertility and menstrual periods if you have a hysterectomy. So after hysterectomy, you can no longer become pregnant, and your periods will stop. If you have not gone through menopause, the surgery will initiate menopause for you, especially if you've had your ovaries removed. So bear in mind, if when you have a hysterectomy, you can no longer have children, and you will no longer have your menstrual cycle, and it will prompt and send a signal to your body to start the menopause process, especially if your ovaries have been removed. And it's not always menopause, right? So if your uterus is removed, but the ovaries are kept intact, they will continue to produce hormones, meaning you will not experience the immediate menopause symptoms. So two key things to two key facts to well, it's almost like three, to remember. So if you have a hysterectomy, you will no longer have children. You will no longer have your menstrual cycle. It will prompt your body to start the menopause process. But it's saying here that although your uterus is removed, if your ovaries are kept intact, that is who continually produces the hormones in your body. It will continue even after hysterectomy, and meaning you won't experience immediate menopause symptoms. So that's something to keep in mind. So, and we have to think about, when I've been talking this whole month, why are hysterectomies done? A hysterectomy is used to treat a variety of gynecological conditions, and some of them I'm going to include here. And if you go back to some of the videos, I have, listed some of the things that they use, talk about as well. So number one is uterine fibroids. The most common reason for a hysterectomy, which causes heavy bleeding and pelvic pressure, is uterine fibroids. They will suggest that you have a hysterectomy for that. The second one is endometriosis. That's a painful condition where tissue similar to the lining of the uterus grows outside of it. The third one is uterine prolapse. When the uterus drops or sags into the vagina due to the weakening of the pelvic muscle. And I did do a video about uterine prolapse. I also talked about uterine fibroids. I also talked about endometriosis in separate videos. The fourth reason is gynecological cancers. That could be cancer of the uterus, the cervix, or your ovaries. That could be a reason for having a hysterectomy. And if you're having abnormal or heavy uterine bleeding, it's chronic, it's persistent bleeding, and does not respond to other medical treatments, your doctor may suggest that you have a hysterectomy. So those are the types of reasons why a hysterectomy is done. So there are 3 types of hysterectomies that are available as well, options, I should say. So there is the total hysterectomy, and that's the most common type, in which removes the entire uterus and the cervix. There is a partial hysterectomy, which removes the upper part of the uterus but leaves the cervix in place. There's a radical hysterectomy, which removes the uterus, the cervix, the upper vagina, and surrounding supportive tissue, typically reserved for cancer cases. So there's three different types of hysterectomy. There's the total one, where your uterus and the cervix is removed. There's a partial one, which just removes the top part of the uterus but leaves the cervix in place. And then there's the radical one that removes the cervix, the uterus, the cervix, the upper vagina, and surrounding supportive tissues, and that's usually reserved for cancer cases. There are also surgical methods when you have a hysterectomy. So depending on your health and the reason for you on this journey towards a hysterectomy is your doctor may perform 3 different types of hysterectomies. There's the laparoscopic, and robotic cancer. There's laparoscopic and robotic surgery, and that one is minimally invasive. That uses small incisions in your stomach area, and a tiny camera guides the procedure. There is the vaginal hysterectomy. The uterus is removed through the vagina, leaving no visible scars on your stomach. There is the abdominal hysterectomy, which is an open surgical procedure where the uterus is removed through a large incision in the lower stomach area. So there are 3 different surgical methods. There's the laparoscopy / robotic surgery. There's the vaginal hysterectomy, and there's the abdominal hysterectomy. So those are the kind of surgical procedures that you could have for hysterectomies. So I went a little deeper and was digging because I wanted to know, how this impacts our uterine health, and how many women are actually having hysterectomies. Because I know in the past it's been something that was highly recommended, but I know now, I won't say it's highly recommended. They use it as the first step rather than the last step. And I talked about that in one of the videos. At least now we know that doctors are not, promptly ready to take the uterus away. So when I did some additional information, and then I did it based off the US, I think I said how many women have hysterectomy annually in the US is what I researched. And approximately 20 million adult women in the US have had a hysterectomy, according to the Center for Disease Control and Prevention, the CDC. So, according to them, 20 million adult women in the US have already had a hysterectomy. And they say the procedure is highly common, and about 500,000 to 600,000 surgeries are performed annually. 500,000 to 600,000 surgeries are performed annually. Hysterectomies have a huge impact on our uterine health. And if women are getting to that point, hopefully working with their doctors, and this is the best plan of healing for them, that's a lot. That's a lot. And I don't know if you remember, but one of the videos I spoke about how one young lady did want to have children, and her and her doctor worked through a number of things, and it took them, like, I think she said, a close to 5 years before she finally decided that, the hysterectomy was the best option for her. And since having the hysterectomy, everything else has gone away, but the desire to have children, she knows she can adopt and things that way. So younger women are also having, hysterectomies in the childbearing age as well. So that's something that, we need to be considered. And that's why sometimes I say we have to be kind to people. We have to be kind to women. We look at them and we don't know what's going on with their bodies. We have to be, really sensitive, and not say things like, when are you going to have some kids? You just never know why they don't have children. Or, you need to lose some weight because you see that stomach, or you might say, congratulations, how many months are you? And it's not any of those things. It's just something. It could be fibroids protruding out. It could just be so many different things happening to a woman's body. So I say we need to have grace for ourselves, but we also need to have grace towards each other, because, hysterectomy is serious. Every surgery is serious, but, that's, yeah. So here's some key prevalent facts that I also looked up that I wanted to share with you, because I wanted to know about the age. I wanted to know about the demographics, because I was just, a little more curious. And they say, when it comes to the age, that everything is surging when it comes to hysterectomy. So hysterectomies are surging from 2.8% for women of the ages 18 to 44. That's usually around your childbearing age. So that number is going up 2.8%. And it's up 41.8% for women 75 and older. And they say by the age of 60, 1 in 3 American women will have had this procedure. 1 in 3 American women, by the time they're 60, will have this procedure. Demographics. According to the CDC, they found that, that Black and white women have a high rate of hysterectomies. Black women are leading hysterectomies. And one of the reasons I found out is because of fibroids and how it just really affects the African American Black woman body. So Black women are having this procedure at a rate of 16.3%. White women are having it at a rate of 15.6%. And so they have the highest rates of women in America having hysterectomies, followed by Hispanic women that's having it at a rate of 12.5%, and Asian women at 6.1%. So the percentage of women having this, Black women and white women, is according to the CDC, is pretty high. Disability status, women with disabilities have a higher rate of undergoing the surgery than those without disabilities. We sometimes don't think about that. Women with disabilities, they are women, and they still have the same issues that we're going through. So depending on what's going on in their other conditions going on in their life, this might be, again, like with all of us, the best option for healing. And they say that, roughly 90% of hysterectomies are performed on non-cancerous conditions like uterine fibroids, abnormal bleeding, and endometriosis. So I hope this gives you just some quick highlighted points about, what endometriosis is and, how it really makes an impact for us as women, um, what it is. So we know that it's a surgery to remove the womb. We understand that once you have it, you can no longer become pregnant and your periods stop, and it can send you into early menopause unless your ovaries are there. Then it will, still produce the hormones, and your ovaries will, and your menopause will start later. And then we understand why it's done: fibroids, endometriosis, uterine prolapse, cancers, heavy bleeding. We understand there's options. And that's the good thing too, to know that there's options for you to have. So maybe you don't want to have a total hysterectomy, which removes the uterus and the cervix. It might just be beneficial for you to have a partial, hysterectomy, which removes the upper part but leaves the cervix intact. And we also understand that when you have a radical hysterectomy, that it's because it's, cancer cells are probably, in that area, and it's probably best to remove as much as possible so that the cancer doesn't, travel. And and then, there are procedures. There's the abdominal hysterectomy, there's a vaginal hysterectomy, and then there's the laparoscopy hysterectomy. So, with me sharing all this information with you, you have an opportunity. If your doctor is presenting this to you, you have the opportunity to know that you have options in each case. And when you sit down and you talk to your doctor and you develop a plan of healing for your body, then you can say, well, instead of having a total, can I have this? Instead of having an abdominal hysterectomy, can I do one with the robotic one? There's options out there, and I'm glad that it's being made known. And part of my responsibility as a uterine health advocate is to spread awareness about it. So it's just not what the doctor says, it is what you and the doctor says together. So I did provide you some information for articles for reference. I have 3 of them. There's a lot of information out there about hysterectomies too. So if you are at that point and you're considering it, then, please know that there's a lot of information out there. So the first article is from the Cleveland Clinic. It was from May 2024, and it's called Hysterectomy, Surgery Types, Side Effects, and Recovery. The second one is from the University of Texas MD Anderson Cancer Center. It was from August 2021. What is a hysterectomy? And the other one is from the Center of Disease Control and Prevention from February 2024. Hysterectomy among women 18 and older, United States 2021. So those are some references that I will also put in the description, that if you are on that journey, hopefully these references will get you started in doing your own research so you can develop a plan of healing for yourself, or you can understand, just like me, what a hysterectomy is. So I hope this information have been helpful to you, as in all the other information I've presented over the last 27 days. And hope it brings clarity to you how uterine health is just not one thing. Is what has taught me. It's a lot of things happening in a little small area of our bodies that makes a big impact on how we function and operate as women in this world. So once again, thank you so much for engaging with the channel. Thank you so much for all of the viewership. I do appreciate that. So until next time, you have a wonderful day.